Greetings, friends and followers. This is Nurses Talking. I am Dale Barzi. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. Today, it is my pleasure to welcome Robin Fillner. Robin is a nurse and health writer. This year marks her 20th year as a bedside nurse. She has experience in emergency, long-term, acute care, community health, orthopedics, and even dabbled in home health. She's now a chemotherapy certified oncology RN. She's also functional nutrition certified through the Functional Nutrition Alliance and writes about the importance of eating well. So, welcome, Robin.
Thank you. So nice to chat with you.
Thank you. I appreciate this. I really am appreciative of you doing this today. But firstly, I usually want to know why people are nurses. So why are you a nurse?
Well, my mom was an army nurse and she also had a debilitating disease. So I was really interested in how her disease developed and then also learning about healthcare and how she was being a nurse. And so I did my undergrad in pre-med and I thought I wanted to go to medical school, but I realized that I had a lot of growing to do and wanted to kind of find myself. So I did a bit of traveling. I even took a semester of grad school in journalism and came back and said, I think I want to be a nurse. So I tried a bunch of different avenues.
So somehow we always manage to come back to it, huh? I think that almost always, once you have tasted nursing, somehow we come back to it. It's not necessarily a lifetime thing for everybody, but it's hard to let go of.
Definitely in my case.
Yeah. So once you actually became a nurse, though, what were some of the adjustments you had to make? What were some of the challenges?
Well, one thing I really had a challenge with was communicating with providers. And they're so busy and they may be in the clinic, they may be in the hospital, they even might be in surgery. And back when I started, the most common way to get in touch with them was through the phone. And so they would get pulled out of patients' rooms and, who knows what. And they were sometimes not that easy or friendly to talk to. And I got hung up on quite a few times, or I couldn't even get out all the things that I wanted to say. So this really affected me, and I didn't even realize how much it had affected me until I went to this retreat one time, and I saw that I was having trouble relating to my family and my friends. So I learned to create some boundaries around that. And then thank God, we now have secure texting and the system is a little bit different now. So it made it easier.
Yeah, that does make it easier. And yeah, I remember those days. I remember those days because people could be I understand their end of it too. Sometimes, they get called from things that are very important. Not that what you're trying to convey to them is not important, but it can be very trying and frustrating, I suppose. So what areas have you worked?
So I started out in emergency right off the bat. And then I went to something called long-term acute care. And it's for patients who are hospitalized for a longer period of time than just right. And they had all kinds of vents and wound care. It was a good learning experience. And then I went over to community care nursing in a clinic setting. I was kind of moving around a little bit, so that's why the jobs were so varied. but I also did orthopedic nursing and then made my way to oncology.
But you see that's the beauty of nursing. You can move around and you can gain all kinds of experience in all kinds of different areas because the one thing we know is and many I guess if you're not into the healthcare field, for most of your perspective, a nurse is a nurse is a nurse. But that's not quite true. Basically, you're doing the same thing, but there's so many specialties.
Right. It's so varied, and you don't even have to work in a hospital.
You don't. There is a niche. I say, often that um, not every niche is for every nurse, but there is a niche for every nurse.
I
You know,
love that.
you just have to
Yeah.
find it. There is a
Right.
niche. Mhm. So, having worked in so many different areas, um, what would you like to see change?
Well, so in healthcare, we're kind of confined to our system and our way of doing things. And sometimes it's really hard to be pulled in several different directions at many times. And as nurses, we're always multitasking and taking care of many patients at one time. Sometimes um, we have patients that require more frequent observation, or perhaps, for moving the patient, we need 4 nurses, or, at times patients can be confused and we need to attend to them, and it can take a couple nurses, but our ratios only call for 1 nurse per patient. So
Mhm.
it can be really challenging. So I think that as nurses, we really need to express our needs and also stick together with organizations as best we can.
So you just mentioned expressing our needs. And I think that as you mentioned organizations, and we have multiple organizations, and yet we are not really getting stuff the way we would like it to be. I don't know if it's ever going to be perfect, but it's not really getting stuff the way we would like it to be. Um, how, if any way, do you think we can express what we want better? Because I believe that if we can get it across better, perhaps we can actually get it. But do you think we can?
I think it's always evolving. I think healthcare is changing day to day, but yeah, we need to talk to our managers, talk to the supervisors, attend those meetings, as much as we might not want to go, but write stuff down so that you can remember, oh, I need to bring this up at the meeting, or take it to the next level higher up if need be. But definitely talking about the issues and concerns that you have is important. If enough people get together and talk about them, then change will happen.
Yeah, yeah. I think so. And I think that we have come to, we vent a lot, but I think we also accept a lot. As you know, it's just recently people have been telling me that, that for example, just one example is, well, we're short-staffed. But then they go on to say, but so is everybody else. Well, that to me is just a form of acceptance. Okay, well, there's nothing we can do about it. And I don't necessarily think that's true.
Right, I agree. I think there are so many nurses that have brilliant thoughts out there. Nurses are absolutely thought leaders, and they need to keep pushing their ideas.
Yep, exactly. What would you like to see in the next 5 to 10 years as far as nursing?
It would be wonderful for nurses to get really good orientation and feel really comfortable. We may not feel 100% comfortable by the time we're going out on our own, but to have an orientation, perhaps with more mentoring, could be really beneficial for people.
Mm-hmm. Yeah, a lot of people feel thrown in at the deep end.
Yeah, I had several different preceptors when I was nursing or when I was starting out, and they all did something different. You know, we all followed the protocols that we needed to follow, but they all had different ways of doing things and accomplishing things and organizing it in their head. And it got pretty confusing for me. And at one point I said, you know, I would really like to just be on my own if that's possible. And and they said, sure, I think you're ready. So
Well, once you start expressing it, you're kind of ready.
right, I think so.
But now that you've come through all of this, you've done a few things. What advice would you give to someone who wants to be a nurse? What would you say?
Well, for somebody who is considering going into nursing, there are so many opportunities. Like we had discussed earlier, there's a way to have your lifestyle and travel, and in the profession, you can make really good money. You can make a good living at it, right? Without having to get a second job. You can advance. And I feel like becoming an RN is a gateway to so many opportunities. And if
Yeah,
you wanted to go to more school, you could become a nurse midwife or an anesthetist or advanced practice nurse practitioner. It's on and on and on. And it's amazing.
yeah. You can do anything. You can do anything at all that you wanted to do. So you went into also functional nutrition.
Right.
First of all, tell us what is functional nutrition?
Well, it's a different model of practice. And so functional nutrition would more or less work with a doctor or perhaps independently to help a person get to the root cause of their symptoms or their chronic disease problems that they're having. So there is a difference between the sort of medicine where you have a disease that has one single cause or etiology, and we're really good at treating those particular diseases. But when it comes to chronic disease or prevention, functional medicine or functional nutrition can step in and look more into the causes such
That's it.
as, yeah, maybe it's inflammation or gene expression or even some digestion issues that you're having to deal with.
Yeah, yeah, yeah. And you mentioned that huge word prevention because, currently really the healthcare system is not really set up as a prevention model. Um, it's a management model rather than a prevention thing. We don't probably pay enough attention to prevention.
Right. I think it's really interesting how once you leave the doctor's office, 80% or whatever number, a huge number of your healthcare is actually done while you're living your life. So so the functional model kind of bridges the gap to help you with behavior change or diet lifestyle changes that make such a huge impact on your health.
Yeah. Yes, indeed. Yes, indeed. Yes, indeed. So one of the things that I speak to nurses about, because we talk a lot about burnout and all of this kind of thing. And I am convinced that a lot of it has to do with the fact that we take care of everyone else except ourselves. So what does self-care mean to you?
Self-care, it's one of my favorite things.
So,
It's so important. I was lucky enough to go into sports when I was in college, and sports has always been a way of stress management for me. I also started doing some yoga and meditation and have found this balance between physical, mental, and spiritual, which I feel like is helps me every day. So whether I'm just taking deep breaths at work or
yeah.
getting some movement in during the day. At least I have those things to fall back on.
Indeed, indeed. What sports?
I live near the ocean.
Mm,
I'm really I practice mountain biking and yoga still, and I go surfing as much as possible in my free time.
okay, okay. I am a water person myself. Anything that happens close to the water, count me in. So
It's
that's
such a
fine.
great feeling.
Isn't it though? Isn't it though? Even just looking at it is therapeutic.
Oh, definitely. Hearing the water is one of my favorite things. It's so wonderful to be out in nature, just seeing the birds and
Yeah.
everything surrounding all the plants. I surround myself with plants in my house.
Yes. As do I, as do I. So, Robin, I have a question. If you could describe if what would be the most essential quality of a nurse to you in one word, what would that word be?
So, I think people look at nurses and say nurses really need to be compassionate, which is true. It's at the heart of nursing. But when you look at everything that a nurse does, all the coordination, all the personalities from, everybody we work with and the patients themselves and the documentation we have to do, I would say flexibility, and then I would also say organization.
Yeah, yeah. Flexibility and organization. Yeah. Actually, those two
Like,
go together quite well.
they do. I kind of cheated and put two words in there, but
No, that's okay. That's fine. That's absolutely fine. And flexibility for me is a big one because very often we have to pivot so many times during the course of one shift and adjust so many times from one patient to the next, from one, dynamic to the next that if you're not flexible, you can't handle that. So yeah.
oh, absolutely. There was a study I read in a nursing journal, and it was about how many times a nurse has to or gets interrupted throughout the day. And it's amazing that we can even function with
I
those
know.
interruptions. That's
Yep,
true.
yep, yep. And somehow we managed to take it in stride and keep going and keep going.
Right.
It's amazing. It's amazing. So, Robin, before we go, is there any gem you'd like to leave us with?
Well, there are so many ways to be a nurse. And one thing that I really learned a lot about while being an oncology nurse is just learning how to sit with people. And sometimes to be a care provider, you don't have to do anything, you just have to be. And when you're in that space, you can be really present with someone. And nursing taught me that more than anything else.
Yeah. I'm glad you brought up being an oncologist because I did mean to ask you about that and what drew you to oncology.
Well, I was pretty burnt out where I was, and I kept meeting these oncology nurses. They were so just compassionate is the word
Mm.
I come to. And I kept seeing them and they said, "Oh, why don't you come over? You seem like an oncology nurse." And I didn't really know what that meant. But once I got there, I was a little intimidated, and everybody tells me this too. It's so sad, and I don't know if I can be with comfort care patients. I want my patients to live, and I realized that I wanted to understand that better. I wanted to, in a way, understand how to face my own mortality in the
Yeah.
process. Right. And learn how to just be with grieving patients. And the hospice nurses, gosh, they've taught me so much, and they have so many skills in providing resources and palliative care and supporting people who are dying.
Yeah.
So that was a huge learning curve for me, as well as, just being in the hospital. It's a center for life. People want to leave the hospital. And so as nurses, we want our patients to live and have good outcomes, but that's not always the case. So being in oncology helped me to understand this a lot better.
Awesome, 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 awesome. Yeah. Um, that's a niche that, takes a really special kind of person, I think.
It takes a lot of understanding, a lot
Yeah.
of being.
A lot of
Yeah.
being, a lot of being. Robin, thank you so, so very much for this conversation. I truly appreciated it.
But thank you for having me. Thanks for doing this.